Hello, everybody, and a very warm welcome to this first session on psychology. In today's session, we will be talking about various specializations in psychology, various careers, and a lot of pros and cons about this field. But before that, let me tell you a little about myself. So, I am Dr. Zarin Sethna. I'm a clinical psychologist. And I have more than 30 years of teaching experience in psychology. I've been an associate professor and head of the department at Degree College. I've been teaching undergraduate and postgraduate students of psychology. Why am I doing this now? That's because I'm very, very passionate about teaching, and I'm very passionate about this subject, psychology. And therefore, I want to reach a very large number of students. And this is a beautiful way of meeting a very, very large number of students. And I can interact with so many students and talk about psychology, which is my favorite subject. Today, we will be discussing about basics about what exactly psychology is, who are some of the mental health professionals besides psychologists, what are the different fields and careers and specializations in psychology, what exactly do they do and where do they work, and what are the limitations and benefits of each of them. Towards the end of it, we'll talk about how will you decide whether this field is really good for you, whether you are the right fit for this field, okay? And overall, what are the advantages and limitations about becoming a psychologist? So we'll give you a good overview so that you can take your informed decision regarding taking up psychology as a full-fledged career, okay? In future sessions, later on in future live sessions, we will be talking about various theories of psychology, explaining and describing different concepts, okay, different principles, different laws. Basically, all the research that has happened up till now in psychology will be focusing on a lot of topics, particularly topics which students traditionally find little difficult to understand. So I'll be focusing on those topics from the syllabus, mainly undergraduate syllabus, so that if you have any issues or problems while understanding those topics, maybe this live sessions will help you to clarify it, okay? In order to receive notifications for your future sessions, it would be nice if you could, subscribe or follow my YouTube channel and click on the notify button. So every time a session comes up, you get a reminder, okay? So that's it. Let's begin. And before we begin, I want to apologize for the slight technical issue that we had in the beginning. Okay, so sorry for that. And we now begin. What I'll be doing is, I'll be presenting my screen, okay? And you'll be seeing a lot of information on the screen, and I will be talking alongside it, right? Please feel free to ask your doubts. What I'll be doing is, I'll first complete my entire presentation, and then I'll go back to your comments and I'll address those comments, okay? Most of the time what happens is, you may have a doubt and you will immediately type the comment. But in the next 2 or 3 slides, that exact doubt will be addressed and, it will be clarified. This often happens, right? So with this then, let's begin. And once again, a very warm welcome to all of you. Please do let me know if you all are able to see the screen. If you could just, somebody could chat or give me a thumbs up in your chat, if you are able to see my first screen. So if somebody could just give me a thumbs up or something, I would know that I'm on the right track. Okay, I believe I'm able to. Yeah, here it is. Okay, so I think you are now able to see my screen. Okay, And we are moving on. So this first screen is a little about me, exactly like I said. All right. And yeah, we begin with what exactly is psychology. Now, what you're seeing on your screen is this symbol. This is the worldwide universally recognized symbol of psychology. Okay. The word psychology comes from the Greek word psyche and logos. Okay. Logos means knowledge or science. Psyche, roughly and loosely translated into mind or consciousness. Okay. So psychology, if you put it together, it is understanding of human mind or understanding of human consciousness or understanding of who a human being is. Okay. This symbol that you see is the Greek symbol pronounced as psi. I hope my Greek pronunciation is correct, but this is the first letter of the word psyche. Okay. So this is the first alphabet, and therefore this is now universally recognized as a symbol for psychology. Just wanted to give you a little background information about the subject that you are about to choose as a career. Now, what exactly is psychology, or how do you define psychology? Psychology is defined in a very straightforward manner. It is a science of human behavior. As simple as that. Okay? Science of human behavior. Now, why do we call it a science? We call it a science because it is a social science. No, just like history and economics and sociology and all other social sciences, psychology is also a social science. What do we mean by social science? Social science means when you are studying human behavior, okay, different aspects of human behavior, that becomes social science. Social because you're talking about human being. But why the word science? Science because when we study psychology, we are following the first three principles over here. So what is science? Science is when you observe things around you, and then there are certain questions in your mind. Why is this happening? Why is it happening? Why is the grass green? Why is the rose red? And when it comes to psychology, why do people fight? Why do countries go to war? Why do people hate each other? What factors affect their shopping behavior? How is it that out of 50 people, you are able to select one person for the job? So when you are asking questions, it comes from observation. And these questions are what we call as hypotheses. Okay, that's what you call hypothesis. You are trying to find the answer. Like in school, we had to prove that. Okay. Once the question has already come to your mind, now you do research. Okay. There are various ways in which you will do research. So now you will conduct research, and at the end of the research, there is going to be testing of hypothesis. So you test whether your research is right or wrong, whether you are on the correct track or wrong track. If you are proving yourself, then slowly it forms into theory. Okay. If you are not getting what you wanted, you start your research all over again. The point is that every theory, every statement which is made in psychology is based on scientific observation and scientific research. Every theory which you will study in psychology, lots and lots and lots of people have conducted thorough, tough research, rigorous research, and that's how you are learning about human behavior. And that's why psychology is a science, a social science. If we are going to study human behavior, then which aspect of human behavior are we studying? We'll be studying physical, cognitive, and emotional behavior. Okay? Physical behavior is what your body does. Walking, sitting, jumping, dancing, crying, laughing, frowning, fighting. Okay? All that is physical behavior. Cognitive behavior is mental behavior. Thinking, imagination, understanding, remembering, okay, forgetting, all that is mental behavior. Decision making, problem solving. Emotional behavior is your feelings. Okay. you're feeling anxious, you're feeling nervous, you're feeling jealous, you're feeling happy. So these are different behaviors that we will be studying in psychology. Okay. Now, who are the different mental health professionals? There are many types of mental health professionals, but the two most important ones are psychologist and psychiatrist. Okay. Now, what is the difference between the two? We'll first talk about psychiatrist. A psychiatrist is a medical doctor. Okay. This person has a medical degree. He or she is a trained medical doctor. And just like other specialization in medicine, you know, some go on to become cardiologists, some go on to become ophthalmologists, and so on and so forth. In the same way, some go on to become psychiatrists. It's a specialization in medicine. A psychiatrist is a person who is trained in understanding mental disorders from the brain point of view and body point of view. Okay. So, psychiatrist is a person who tries to understand different parts of the brain, different hormonal changes, different neurotransmitters, and how they interact and how they affect behavior. Okay. A psychiatrist, because he or she is a trained medical doctor, they are licensed to give you medicine. Okay. So, if a patient visits a psychiatrist, he or she is licensed to give you medicines if required. Okay. Who is a psychologist? A psychologist is a person who is a graduate, postgraduate, who has a postgraduate degree either in arts or science stream. Now, why am I saying arts or science? Because in certain universities, psychology is offered under humanities. So, you need to do BA and then MA in psychology. But in certain universities, psychology is offered under science stream. So, in that case, you will be doing BSc or MSc in psychology. Okay. It really, there is very minute difference between the two. Either case, whether you have a MA degree in psychology or MSc degree in psychology, that will make you a psychologist. Okay. A psychologist is someone who's trained in conducting various psychometric tests on the client. So, when a client visits us, we conduct various personality tests, IQ tests, aptitude tests, etc., etc. Okay, to find out about that person and what the person is really suffering from. And psychologist is, of course, trained in counseling and therapy too. So, once you have decided what the person's issues are, then the client and the psychologist both work together towards healing. You help the client to deal with the issue that he or she has. Okay. So, this is the broad difference between a psychologist and a psychiatrist. Now, before we go on to who are the different types of psychologists and what work they do, it's very, very important to address the various taboos and stigmas and myths and misconceptions about psychology. Okay. People believe that you only have to go to a psychologist if you're completely crazy. Okay. And psychology is probably a witchcraft. As you can see in this diagram over here, you know, the photograph over there, you know, a psychologist is someone who will sit with a crystal ball, or a psychologist is someone who will sit with a pendulum, you know, moving to and fro in front of you. No. Psychology, like we saw earlier, is an extremely scientific field. Everything we do is based on scientific research. So, it is not witchcraft. It is not jadoo tona. Psychology is not jadoo tona. Okay. A psychologist does not solve clients' problems. Now, please remember, we are using the word client. We are not using the word patient. What is the difference? When we say patient, it means something is wrong with the person. But when we say client, it means the person is okay, but there is some issue that the person is not able to deal with. For example, if I have a legal issue, I'm not a lawyer. I cannot fight my own case. I will have to take the help of a lawyer. So I become a client. I cannot file my own tax returns. I'm not a qualified chartered accountant. So if I need tax problems, I need a chartered accountant. I am a client over there. So what are we doing? We are simply going there for services. Okay. Similarly with psychologist, a person may not be able to handle his or her issues, emotional issues, mental issues. They are coming to ask for our services. They are coming to us for help. Okay. And therefore we are using the word client. Now a psychologist does not solve a client's problems. Why? Because one reason, we cannot. Your life is your own. Only you know how and what the circumstances are. I cannot actually come and solve problems for you. Secondly, even if I solve the problem today, okay, that is not the end of it. You're going to have many more problems in future. Does it mean every time you have a problem, you'll come to me, pay fees and I'll solve problem for you? Not practical. What a psychologist does, and a successful psychologist, what does a successful psychologist do? A successful psychologist is a person who helps the client or equips the client with skills that will help him or her in future to solve his or her problems. Okay. So when a client comes to me, I train them in solving issues. So tomorrow if there is a new problem, they can still use those skills and resolve them. Okay. Counseling does not mean giving advice. Again, I cannot tell you what to do. In the end, you have to live your life. In the end, your relationships are your own. In the end, your life is your own. I cannot tell you do this or do that. A psychologist only clarifies the picture for the client. Okay. It's like putting all the cards on the table, but the final decision always is with the client. And that is why counseling or therapy only works best when the client is cooperating. You cannot force therapy on a person who doesn't want therapy. Okay. So giving advice doesn't come into the picture at all. A lot of people, if you are a psychology student, you must have experienced this. You go somewhere, you are traveling, you go to family functions, people ask you, what are you doing? And you say, I'm a psychologist. And I'm sure the first reaction you get is, oh my God, that means you know what is going on in my mind. No, we are not mind readers. Okay. Even if you're sitting in front of me, I can't tell what's going on in your mind. Okay. We are not magicians, we are not astrologers, we are not mind readers. Okay. But because a psychologist is trained in understanding body language, understanding the meaning of voice quality, what I can do, which maybe a non-psychology person cannot do, is if you're sitting in front of me and talking, I can observe your body, what you're doing, how you're moving your different parts of your body, how much your voice is trembling, at which word you had tears in your eyes, on which sentence you started trembling. So that will, I'm trained in understanding that. So that will give me very strong cues in understanding you little better. Okay. So yes, we can understand human behavior a little better because we are trained, but we are not mind readers. Okay. And of course, we are definitely not fortune tellers. A psychologist cannot tell you what's going to happen in your life tomorrow. Okay. But again, yes, because we psychologists are trained in understanding personality, understanding IQ. I can give you a few tests and I can find out your personality type. I can find out your IQ type. I can find out your interest areas. Based on those scientific test results, I can predict that you are going to be very ambitious, you are going to be very hardworking, you are not going to be very hardworking, you are going to be happy in a job, high pressure job, or you are going to be happy in, music and arts. That much I can predict. But exactly what you are going to do and exactly what's going to happen in your life, a psychologist cannot predict. Okay. So these are just some misconceptions which people have, and it's better to clear them. Okay. We are now coming to specializations. Now, of course, there are many types of specializations, but these are some of the most popular ones. Okay. Now, before I talk about these specializations, a few things. Just like every field, engineering, medical, every field has specialization. So if you're taking up engineering, you can become a mechanical engineer, civil engineer, computer engineer. No? If you're going into medicine, you can become a cardiologist, you can become an orthopedic, and so on and so forth. Similarly, if you become a psychologist, then you can become all of this, what you see on your screen. You can become a sports psychologist or clinical psychologist or neuropsychologist or school psychologist or experimental psychologist. Okay. So these are different specializations. Now, depending on which university you are in, different universities offer different specializations. What do I mean by that? It means University A will have 3-4 specializations and you have to select any one from that. University B will have another 4-5 specializations and you have to select from that. Okay. So you won't have all these specializations offered in one single place. Okay. There'll be just a small number of specializations. You pick up any one. Now suppose you're living in a city, you're going to a university which is offering 4 specializations to you. For example, your university is offering clinical, counseling, social and developmental. Okay. But you don't want to do that. You want to do neuropsychology. So what do? You change your university. That's what students do. Okay. So if you're very clear, okay, this is my field, but in this place, I'm not getting that, then for the purpose of education, you will have to change your university. You will have to take admission in a place which offers your choice of specialization. You will have to live there in a hostel like most students do and get the degree of your choice. Okay. So that's how it is. Each specialization over here that you're seeing on your screen are very, very different from each other. Okay. And we will talk about each of them in great detail. Exactly what work do they do? Where do they work? The pros and cons. All right. Right. We are starting with the most popular field of psychology, clinical psychologist. Why did I say most popular? Because there is some data which says that all over the world, amongst all the psychology students, almost 70% students choose clinical. Okay, it is one of the most popular fields in clinical psychology. Now, who exactly is a clinical psychologist? A clinical psychologist is a postgraduate person who is trained in understanding mental disorders. Okay. So, if you take up clinical psychology, you will be trained in understanding different types of mental disorders, how to diagnose them. So, different tests that we use, how to find out, how to interview, how to diagnose, how to use those tests, and then how to help a person to deal with it. So a client comes to me, and by talking to the client and by talking to the family members and by giving the test, I realize the client is suffering from depression. Okay. So now we have done the diagnosis. Now what? Now begins treatment. Okay. So this is what a clinical psychologist will do. Clinical psychologists, as you can see, will usually work in hospitals. Most hospitals have a psychiatric ward attached to it. Okay. So that's where a person suffering from mental disorders will be, staying. Clinical psychologists work over there. There are also a lot of mental health clinics, specialized mental health clinics. So a clinical psychologist can work over there with patients. A clinical psychologist can always have a private practice, just like every other field. You can have your own private practice, but private practice usually comes after a few years of experience, not when you're very fresh. Okay, you will need a lot of experience. So initially what people do is you become a clinical psychologist and then you have to take a license. Okay, you have to apply for license to practice, and once you get that license, after that you either work in hospitals, you work with private clinics, or you work with a psychiatrist to gain experience. And once after many years you are confident about your skills, then you can open your private practice. Okay. Rehabilitation centers are also another place where you work. Now, why is clinical psychology field so popular compared to other specializations? That's because a clinical psychologist can work in clinical setting, but can also work in other settings. Okay, a clinical psychologist can also sometimes, not always, but sometimes do the work of industrial psychologist, can do counseling, can become a school counselor. Okay, there are many areas in which a clinical psychologist can work, and that is why it's a very broad field, making it more popular among the students. Take up clinical psychology if you are prepared to study in great detail about human brain, its various structures, what work each part does, how it affects behavior, and you'll have to be up to date with latest research. Take up clinical psychology if you're okay in constantly working with patients who are not in touch with reality, people who suffer from severe mental disorders. If you think you have that type of personality, take it up. Then the second popular field is counseling psychology. Now, counseling psychology is similar to clinical psychology, but yet very different. Okay. Counseling psychologists, or a counselor as we sometimes call them, they are people who deal with little milder issues. Okay, not very severe cases like suicidal case or severely violent case. No, they deal with slightly more milder cases like everyday stress, everyday life decisions, okay, relationship issues, parent-child relationship, teacher-student relationship, marital of course, okay, or teenagers having issues in their love life, or teenagers not knowing how to, or people not knowing how to deal with breakup of a romantic relationship, or career counseling, okay. So these are the areas largely, broadly that a counselor deals with. A counselor's job is to understand, make the client understand what exactly the issue is, where it is coming from, and provide emotional support, help the client to deal with that present crisis that he or she is going through. A counseling psychologist is someone who, sort of hand-holding. It's like a hand-holding thing. You support and stay with your client till that difficult period in the client's life is over with and the client is able to handle this and all future crises. Okay. Counseling psychologists can work in schools and colleges with students, but also with staff, teachers, etc. There are a lot of private counseling centers. So you can join one of those centers and you can become a counselor. You can have your own absolutely private practice. You can work with NGOs or social service organizations, NGOs which deal with rehabilitation centers again, or orphanages or old age homes. Most of these places would require a counselor. Okay, so that's, if you're interested, that's about counseling psychology. Very rapidly growing field in today's world, industrial organizations, organizational psychology. In short, it is usually called IPOB. IP is industrial psychology. OB is organizational behavior. Vithra, you can only do one specialization at a time, but under NEP, you might have that option now. Okay, but usually only one specialization at a time. I hope I have answered your question, Vithra. Okay, now coming back to IPOB, Industrial Organizational Psychologist. Like I said earlier, it is a very rapidly growing field, becoming very popular. Why? Because in the last few years, in a decade or so, most companies, corporate houses, organizations have realized that mental health of our employees is very important. Because if an employee has good job satisfaction, you are mentally satisfied with your job, you are in a happy frame of mind, okay, that will directly affect your work. If you are conscious, worried, irritated, not happy with the surrounding in your job, it will directly affect the quality of the work. So company suffers, product suffers, profit suffers. So now companies have started realizing the importance of mental health and well-being of their employees. And that is why now most companies employ industrial or organizational psychologists. Okay. What is the work of industrial organizational psychologists? They try to improve employee performance and work culture. Sometimes very simple things can suddenly improve your productivity and improve your work culture. Simple things like understanding good seating arrangement, as simple as that. Nothing fancy, nothing great, okay? But you visit a company and you realize people are not doing well simply because the seating arrangement is bad. The kind of tables and chairs provided to them are not giving them enough support. They are not facing each other. They are only facing, everybody is facing the wall. There is no interaction and therefore the work is suffering. You just change the structure, furniture structure in the room. Now, people are facing light, you put a pot, you just have good lighting, you just clean up the place. There is interaction happening, you can discuss face to face, you can take each other's help. Suddenly the atmosphere becomes positive, suddenly productivity improves. Okay, these are simple examples which I am giving. So sometimes all you need is very simple changes, but that's what an industrial psychologist can come up with. Improving relationships within the work culture. Your job is a place where you're going to spend a major part of your life, okay? And morning to evening, many hours you're spending with your co-workers. It is very important to have healthy, happy relationships. That's the job of an industrial psychologist. Industrial psychologist also has a very important responsibility of improving relationships between management and the workers, okay? Employer and employees. Because over there, if there is a rift or friction, things are going down, right? So these are some of the areas they work with. They also work with help in hiring and training. Now, during interviews, you may select people based on their qualifications. But a lot many times they don't see, they don't see personality type. For example, a very talkative person, you put that person in an accounting department, okay? Now, accounts is an area where you need concentration and focus. A very talkative person will go there. Not only will he or she be very talkative, but probably disturb everybody else too, okay? Or a very shy, very quiet person, you put that person in sales and marketing. Not going to work, because in sales and marketing, you need to talk. You need to talk with strangers. You need to be friendly, okay? So you have to match personality type with the type of work he or she is doing. And that's where an industrial psychologist helps. Once you are already employed, you've got a job, now what? Technology keeps changing, work culture keeps changing, expectation keep changing, and therefore training becomes important. So you need to provide training to newcomers, you need to provide training to middle-aged people who are in leadership roles. So you have to give them motivational training, leadership training, and so on and so forth. That's what an IP person will do. So they work on improving job satisfaction and motivation. Obviously, they work in HR departments or personnel departments of corporate offices, okay? They will also be working with consulting firms, consultation, So they don't work full-time in one place, but they are consulting many different companies, okay? A, B, C, D company will consult them for their expertise. You will also work with startups, okay? People who are just starting out and they have zero knowledge about the work culture, you could help them. Social psychologist. Tanvi, you can enter IP with clinical psychology, but in that case, what usually companies demand is you should at least have some diploma in industrial psychology, 1 year diploma at least, or some diploma in management, personnel management or something like that, okay? You can, if the company is ready to take you, fine, but you might feel that you're not fully equipped to work over there. So it would be better if you already have a clinical psychology degree, then it would be, I would suggest that you take 1 year diploma in some management field, HR management, personnel management, or industrial psychology. That will make your resume very strong. Also, that will make you very confident in working in IP field. I hope I've answered your question, Tanvi. Okay, going back to social psychologist, as the word tells you, social meaning society, people, okay? So, social psychologist tries to understand human behavior in groups, okay? So, when I'm in a group, how do I behave, okay? Or how groups impact me. Like you must have noticed, when I'm alone, I behave very responsibly. But if 10 friends go in a cafe, then what do? You scream, you shout, you make noise, you crack jokes. Okay? Because you are in a group. Why? Because in a group, your identity is not visible. Okay? In a group, I become invisible. 9 people are making noise. If I also make noise, chalta hai. Okay? But if I go and sit alone in a restaurant, I am very well behaved because now I am responsible for my behavior. So group impacts our behavior. That's what social psychologists study. How society has an effect on our thinking, on our behavior. How log kya kahenge will affect your behavior and so on. Social psychologist is a person who will study areas like peer pressure. Mostly happens in schools and colleges. All your friends are smoking, so should I smoke or not smoke? Okay. All my friends are going to take commerce, so what should I do? I'm the only one going in for arts. Peer pressure is important. Attitudes and what your thinking processes are, social influences, what factors affect you. This is the work of social psychologists. They will work in universities and research institutes. They work in NGOs because NGO is a place where you have so many people. They cater to people, NGOs work with village groups. NGOs work with homeless. NGOs work with drug addicts. So different groups behave differently. That's where social psychologists will work. Social psychologist plays a very, very important role with government organizations. It is very important for the government to understand what population is thinking, what type of policies they want, what type of education system they want, what type of tax they want, okay? Which part of the country has more fighting happening? Which of the part of the country is more peaceful? So what is the difference? Why is this more peaceful? Why is that more violent? Okay. Why are human beings behaving differently in two different places? This government, it becomes very important for the government to understand that. And therefore, a lot of government agencies employ social psychologists. Market research companies will need social psychologists. Okay. What products are more attractive to people? Okay. One research tells that attractive packing plays a very, very big role, and some colors are more attractive to human eyes, some color combinations, like for example, red and white. Red and white is a very attractive color combination. Okay. And research shows that people buy a product more if it is red and white packing compared to other color combinations. Now, how did we find out? We did research on human behavior. Okay. When you visit a mall, there are certain products absolutely down. You have to sit down and pick it up. But there are certain products at eye level, and there are certain products completely on the top shelf. Which product should be placed where so that people will buy it more? That is science. Okay. And these are small things which a social psychologist will study. Human behavior. What kind of shopping patterns I have. Okay. And so on. And therefore, marketing research institutes will employ social psychologists. Then we have developmental psychologist. As the word tells you, a developmental psychologist is a person who studies human development from birth to death. But it is not just from birth to death, because life does not begin at birth. Life in fact begins before birth. Okay. Life in fact begins even before a woman becomes pregnant. The type of parents you have, their DNA, their genes, who they are, their personality types is going to affect the child which is not even conceived as yet. So, developmental psychology studies from there onwards. Okay, from the time a child is conceived till the person is born, grows up, dies, and a person's life ends at death. But that is the end of that person. That is not the end of the journey. Because when one person dies, many people around them are affected. A woman will become a widow. A man will become a widower. A parent will become childless. A child will become an orphan. So many changes are going to take place in so many other people's lives. So life is not just born and dying. Life starts before birth and life goes beyond death. And that's the job of a developmental psychologist. This is what they study, different changes in human life according to age. Okay? They will work in schools because that's where, you start in KG and you finish off when you're 15 years old. So look at the kind of changes a child goes through. So schools will employ them. Hospitals, because again, different age group patients come in. So you need to understand which age group, what type of behavior. Child development centers, research organizations, also specialized institutes which work with, specialized cases like autistic children or ADHD, very specialized groups. So that's where developmental psychologists can be employed. Again, this is very obvious. Sports psychologists in the last few years, in fact, a decade or so, a very, very rapidly growing field because sports has now, been accepted as a profession. Many years ago, sports was considered as just a hobby. You play some sport, you come back home, but you have to have a proper job. In the last many years, becoming a full-time sportsman is actually a profession. You can become a full-time, athlete, right? And that is your profession. Now, if that is your full-time profession, then your well-being matters. And that's where sports psychology has gained a lot of prominence. Sports psychologists will obviously work with athletes. You help them to improve focus, confidence, performance. You help them to understand what is working for you as an athlete. If I'm an athlete, what are the factors that are affecting my behavior? Okay. How to deal with success and failure. Both training is required. Okay. I'll give you one small example. There was this case of a athlete. She was a state level or national level winner. Okay. She was a national level, I think she was a winner running, and she started losing. Okay. She had consistently been a winner from local to state to national level, and suddenly she started coming 4th, 5th, 6th. And she was not able to understand why. I'm having the same practice, I'm having the same fitness level, I'm still running at the same speed. What is going wrong? Why am I losing races? So they consulted the sports psychologist. And then the sports psychologist and the athlete both sat with the videos, all her past videos, and they started seeing what is going wrong. And you know what they noticed? In all the races, in the beginning, this girl was taking a lead because she was a champion. Okay. So she runs fast. When she is very close to the finish line, she looks behind to check about her other people, other competitors. Okay. How far they are. So she would look behind just for half a second. She would look behind to see whether others are close or not. And after that, immediately her speed dropped because when she would look behind, she would realize that others are far behind. And immediately her brain tells her unconsciously, oh, I have already won. They are far behind. I don't need to work so hard. Unconsciously your brain gives you that message. Her body now speeds less. Immediately her speed goes down. And because her speed goes, in sports, every second matters. So because of that split second decision, the person who was second and third takes over. And she started losing all the races. Now, this small thing was noticed by a sports psychologist, right? It was just an example. There are many other things that they do. Okay, they work with fitness level, mental motivational level, etc. They will work with sports team, all the sports academies, sports academies, fitness centers and gyms. Okay, and they can always have their private practice. You can go to people's home and train them. You can privately work with sportsmen if they are ready to hire you. Okay, so that's an interesting field and a very upcoming field. Neuropsychologist, slightly difficult in terms of studies. Okay, in fact, I would say more difficult in terms of studies. Extremely interesting, wonderful field. Again, an upcoming field. Again, as the word tells you, neuropsychologist. So you are going to study nervous system in detail. Nervous system. So you are going to be studying nervous system in great detail. Okay. So a neuropsychologist is a person who studies brain and behavior relationship. Now, a lot of neuropsychology is also studied by clinical psychologists. Okay. Like I told you right in the beginning. Clinical psychology also studies a lot of brain structures in detail. Neuropsychology studies even more detail, more than a clinical person. Okay? So, different parts of the brain, how they affect behavior, what they do. If something goes wrong in one part of the brain, what is the effect on the person's behavior, and so on and so forth. Obviously, they will work with patients having brain injuries or severe disorders. Okay? They'll work in hospitals, specialized neurology clinics, like you have dementia patients. So there would be specialized clinics for such patients, that way. So neurology clinics, rehabilitation centers, where people are trying to, rehabilitate or learning to cope out after trauma, and research labs. They engage themselves a lot in research. Again, in the last few years, criminal and forensic psychology has gained a lot of popularity. If you're used to watching a lot of crime shows on TV, then they keep talking about criminal psychologists or forensic psychologists over there. So students are now finding it very intriguing and interesting, and slowly a lot of universities are offering this as a specialization. Obviously, they work with investigative agencies. So criminal and forensic psychologists work with police department and all other agencies which are into investigation. They help in mapping the profile of a criminal, particularly serial criminals, habitual offenders, right? When you study their crime, you will see a pattern. A psychologist will see a typical personality pattern. So they help in mapping of this profile, criminal profile, and that helps the agencies to understand the mind of a criminal, predict what will happen next, and stop the crime from happening also sometimes. All right. After the crime has taken place, a criminal psychologist or a forensic psychologist can help in pinpointing the culprit, who has exactly done what. Their training will help them to understand clues that you get from the crime scene. Okay, and they pass on those to the investigative agencies. They will also help the investigative agencies in interrogation. So when you catch a suspect, you have to interrogate them. How do you know whether the person is lying or not lying, and so on and so forth. So a forensic or a criminal psychologist would be trained over here in interrogation. So they help out in interrogation. They will also be required to go to court. When the case reaches the court level, they'll have to go there and give a testimony also of their findings. All right. They will work with prisons and prisoners, understanding and profiling prisoners, and trying to see if there is scope for improvement, because that's exactly what a prison is. You are sending a person to be punished, but you also don't want the person to spend the rest of the life only in punishment. You also want that person to become a better human being and maybe come back in society and live a healthy life. So that's one area that criminal psychologists will work with. Courts, like I just told you, police departments, and forensic labs. Forensics are where you are trying to search for cues and clues as to the investigation. Upcoming field, and a lot of kids are doing it. One of the most common and most popular since last many years. Okay, educational psychologist and a school psychologist. Now, before I talk about this, small note. Although educational and school are interchangeable, but there is a tiny difference between the two. Although in practice, it may not happen. But in theory, an educational psychologist is a person who, strictly speaking, doesn't need to come in touch with children. Okay, you don't directly have to work with students, but an educational psychologist is a person who will, help in designing syllabus. So in 5th standard, what is the brain development of a child? So according to that brain development, what subjects the child should use, or what should be the difficulty level? At what age should we introduce difficult scientific concept? At what age should we make a child learn different languages? At what age should we introduce a child to, music or something like that, right? So they are the ones who help in setting up syllabus. They are the ones who will help in planning out academic timetable. Which month is the best month for starting? How many days you should have school or colleges? 5 days, 6 days, 4 days. Okay. How long should be the, each lecture should be of what duration? So if you're in school, you're a child, your attention span is less, 30 minutes would be enough. If you're in college, graduate student, 1 hour. You are in almost adult, 1 hour. If you're postgraduate student, 2 hours, because now you're absolutely an adult, you can focus for 2 hours. So what should be the duration of the lecture hour? How many exams should be conducted? What type of exams? How many marks paper should you have? 100 mark, 50 mark, 10 mark. Okay. So this designing of educational program is mainly the job of a educational psychologist, and therefore they mainly work in boards, HSC board, SSC board, CBSE board. Their main job is over there. But like I said, that is only on paper. In theory, they may do the work of a school psychologist also. School psychologist is a person who comes directly in contact with students, school students, but also college students. So we use the word school psychologist, we don't say college psychologist. Okay, a counselor works in both places. School psychologist directly works with students either as a group or individually. So for example, a school psychologist may train teachers on how to make lectures more interesting, how to motivate children, or how to deal with the problems of the children. For example, see what will happen is, in the end, who enters the classroom? Teacher. Subject teacher enters the classroom. Counselor doesn't take lectures. Counselor doesn't teach, right? A teacher is a person who is spending more time with the students. So a teacher has to deal with fear, anxiety, overconfidence, mischief, quiet, all these different personalities a teacher has to deal. So a school counselor trains the teachers to deal with these situations. But suppose there are specialized cases, like there was a brilliant child doing very well, very talkative, very active. Suddenly the child started failing. Suddenly the child stopped talking to everybody. Suddenly the child stopped participating in activities. Now this is a sudden change, but it is just one case. Now the teacher will refer this child to the counselor. So privately you speak to the child and try to find out and help the child to cope with that trauma. Okay. So obviously school and educational and you also work with parents. Many times parents have difficulties in dealing with children. So many times you need to have workshops and training sessions for parents also. Schools, educational boards, special education centers, and child guidance clinics. These are the areas where usually a person would be employed. Health psychologist. Now, what is the difference between a health psychologist and a neuropsychologist? Because both are studying behavior, no? And both are studying body. Okay, there is a difference. A neuropsychologist or a clinical psychologist is interested in brain functioning and its direct effect on behavior. Health psychologist is interested in overall health of a person, your immune system, how often you fall sick or how healthy you are, and how that affects your health, how your stress affects your health, okay, how your mood affects your health, your behavior. So overall health is studied by health psychologists. They study the link between physical health and mental health and behavior. Okay, they promote healthy lifestyles. So how to deal with stress so that it doesn't affect your health and your life, other aspects of your life, and so on and so forth. They can work in hospitals, wellness centers. There are a lot of wellness centers, gyms, fitness centers, again NGOs, and public health organizations. Okay. Vrithra, coming back to your question, DEd is a completely different stream, dear. Okay, it's a completely different stream. If you want to become a psychologist, you will need a degree in psychology. Okay, these are two completely different areas. So you will need a UG and PG degree in psychology if you want to become a psychologist. I hope I've answered your question. Okay. And we reach the end. Experimental psychologist. Now look at the word experimental, coming from the word experiment, research. Who is this person? This person is the foundation of everybody that we have been talking about up till now. Okay. Experimental psychologist is a person who is conducting experiments in the laboratory or outside. Railway stations, malls, crowded places, villages, cities, film centers, everywhere. Studying human behavior. Okay. And they are the ones who are doing research on human behavior, and based on their research, the research done by experimental psychologists is going to be used by industrial psychologists, sports psychologists, social psychologists, and so on and so forth. Okay, so they are the foundations. They are studying human behavior scientifically, and they are conducting research, and that research is later on used by everybody else. They will work in universities, research centers, government research bodies, and there are private research centers too. So if you are someone who enjoys experiments and research, then you can take up this kind of a field. Okay. Thank you, Revati, for your compliment. Thank you very much. I'm glad I'm able to reach out. Okay. Now, with this we end the various careers and specializations in psychology. Now, before I go on to the next screen, there is something very important that I want to talk about, particularly to young students. Okay. Now, when students are selecting career, psychology or any other career, students themselves and people, always the first question they ask is there scope over here? Okay, that is one question, and nothing wrong with that question. Absolutely nothing wrong with that question. Obviously, you should find out if there is a scope. After all, you're going to spend your life over here, right? Okay, Vritha, I'll come back to your question in a while. Let me please complete my point. Okay, right. So, talking about scope, is there scope in psychology? Or if I want to take up psychology, then with specialization, where is the scope? Please get it clear. Colleges and universities will give you knowledge. They will give you education. They will give you information. They will train you in your skills. They will give you degree. But they will not give you scope. Nobody can give you scope. Scope is not something which is available outside, you go and take. Scope is something that you create for yourself. Scope is your place that you are going to make for yourself. When you come in this field or any field, any subject, any field, there are already thousands and lakhs of people working in that field. You will have to make your place over there. There is no ready-made vacancy which you will go and fill up. You will have to create that vacancy. So scope means how will I use all the knowledge that my school and college and university has given me? How will I make use of all my skills which I have? Okay. So scope means how I apply for jobs, how I talk to people, how I communicate, how I behave, how I prove to others that I'm good. Take me. Okay. Scope means I make a place for myself so that company will hire me and make me permanent. My honesty, my integrity, my hard work, my trustworthiness, my punctuality, that will decide whether I'm going to be employed and I'm going to continue in a field for a very, very long time. Scope is how you make use of everything that the world has taught you. Okay? So every field and every subject in this world has scope. It all depends on what you're going to do. Okay? Before I go on to the next slide, let me please answer the question. So Vitra, Good. You already have a BSc degree in psychology. If you want to practice psychology, just undergraduate degree is not enough. You must have a postgraduate degree and perhaps a diploma or two also, okay, to refine your skills. Just having a undergraduate degree will not qualify you to become a psychologist. Okay, what is the difference in job between health and developmental hospitals? Okay, now we have studied about all these specializations, but sometimes you're right. In actual practice they merge, they collide. Okay, so when you actually go out in the field, a lot of developmental work will be done by health psychologists and a lot of health psychologists will be done by developmental. Okay, it will collide. So on paper, in practice, there may not be much of a difference. The difference is approach. Okay, so a developmental psychologist is going to focus on all the changes that take place based on age. That is the focus. Age is the focus. Health psychologist is going to focus on how my mental health is affecting my physical health, or opposite, how my physical health is affecting my mental health. So focus is different. But when you actually start practicing, sometimes, the principles merge. Then it merges. Okay. So I hope I've answered your question. Oh, very good. Akash Bhardwaj, yes, I'm glad. Yes, of course. It's important for you to learn about human behavior. Yes. But for that matter, everybody needs to know a little about human behavior, right? Yeah. Okay. So with this, we end our slides, but there are still many more slides. Please stay with us. So specializations part is over. We are now talking about benefits of, taking up psychology as a career. Now, okay, first and biggest benefit of taking up psychology as a career is you are going to be doing a lot of meaningful work. You're actually sitting over there with clients and you know that you're helping this person at a time when the person is most helpless, completely confused, not able to do anything, completely lost. At that moment, you are there to help that person. That feeling itself is very amazing. Okay. It becomes even more meaningful when you have seen a client, for many sessions who has gone through terrible life experience, terrible trauma. But at the end of your sessions, that person goes out with a smile on the face and says, I am feeling much better. Now I can deal with this life. Okay. It's an extremely satisfying feeling. Very few professions will give you that feeling, right? So it's a very meaningful work. You're actually bringing about change in people's lives. Another good thing is there is a growing awareness. A few years ago, psychology was, people associated psychology with only, oh, you have to be crazy to study psychology. Okay. But now mental health field is growing, awareness is growing, mainly because of social media and the discussion that is happening. So now people look at it with respect. Okay. And people are okay with you taking up this field. And if you tell people you're a psychologist, they understand what you're doing. Like we just saw, career options are very wide. There are so many things that you can do as a psychologist and work in different fields. Okay. So that is a big advantage. Flexible work hours. If you're a psychologist, you can decide to become a full-timer somewhere, or you can decide your timing. Okay. So, this especially helps young mothers. You have just had a child and you need to be with your child for many hours in a day, but you still have 4-5 hours free. So within that time, you can still practice. Okay. You can only work 3 days in a week, but the other 4 days of the week, you need to stay at home or do something else. Okay. So this flexibility is possible in this field because if you're privately practicing, or if you're into consultation. Okay. But the most important advantage is your own personal growth. When you study human behavior, you're also studying yourself. You're understanding your own self. Okay. Now you know why I get irritated with these things, or why I'm able to tolerate that, why I hate that person, why I'm jealous of that person, why I behave differently in different situations. It helps you to become a better person. It helps you to control your emotions. It helps you to modify your behavior. Okay, so it's amazing for your own personal growth, even if you're not going to practice professionally. Okay, so these are the benefits. Limitations of psychology as a career. One, it's a long study journey. Like I just said, just having a graduate degree is not enough. You need to be a graduate, then you need to be a postgraduate honors degree, and sometimes even that is not enough. After that, you will have to apply for license if you want to practice. But you will also, and most psychologists who are practicing, they usually take up 1 or 2 years extra diploma course, diploma in trauma management, diploma in suicide prevention, diploma in stress and coping. So those specialized diploma courses people usually take up. So it's a very long study journey, many years you are going in. If you're ready for that, amazing. In the beginning, income can be low. No, it's not like I've got all my degrees, I've got all my diplomas, I've got a license, I'm going out in the field and I will start earning, 5-figure salary. That's not going to happen so soon, not in the early stages. You will require a few years to, be confident of your own skills and to gain experience. After that, yes, earning is on par with many other professions. So there are psychologists who are doing very, very, very well, but that will come a little later in life. There are still taboo and stigma. Like we just saw, yes, the world is understanding the importance of mental health and, awareness has come up, but there is still taboo and stigma. A lot of students go and tell their parents after 10th standard or 12th standard that I want to take up psychology, and a lot of time parents discourage, no, that's not the right field for you. Go in for something better. Psychology is only for people who are studying crazy behavior, or psychology is only a hobby. It cannot become a profession. Okay, so that misunderstanding and taboo is still there. You'll have to deal with that. You'll have to fight it out with that. Okay. The biggest problem of being a practicing psychologist is it is a very emotionally demanding field, particularly if you're a counselor or a clinical psychologist, because day in and day out, one case after another, you are constantly meeting people who have gone through terrible life experiences, terrible trauma. There are people who have gone through betrayal and breakup in their relationships. There are people who have gone through sexual assault and molestation. There are people who have gone through terrible exploitation as a child. Okay, there are people who are dealing with infidelity. There are people who are facing workplace sexual exploitation. It is not easy to listen to these stories. Okay, you will have goosebumps in the beginning, and in the beginning when you're practicing, it will pull you down emotionally. You become disturbed because you are constantly seeing the dark side of human behavior. You start feeling nobody is good, everybody is bad. Okay, so it is emotionally very demanding. You have to be prepared for that. Be prepared. Your training will train you. Your PG course will train you for that. You will be trained to deal with all this. Okay, it's a part of internship, but it is demanding. After some time, you learn to separate your emotions from the client. So a time will come when you will no longer be affected. Okay, but be prepared for this. Okay, let me please go back to a new comment which has come. Okay, now as far as possible, if you're taking up psychology and you're planning to, practice psychology, you want to become a psychologist, practicing psychologist, please avoid distance online education. Psychology is a study of human behavior. You need to be physically trained. Okay, remote training, how do you understand human behavior? How is it going to make you a psychologist if you don't have human contact? All right, you will only have theories. So if you just want a psychology degree only to understand what psychology is, only to understand human behavior, fine. Online is fine. Distance education is fine. But if you want to practice, please follow the regular offline pattern. you need to attend lectures, you need to be trained physically, okay, you need to have internship, you will have to visit hospitals. If you are taking up clinical, you will go to hospitals and work with patients. If you are taking up industrial, you will go to corporate and work as an intern. Okay, there are practical training in the field training hota hai. So distance education will not give you that kind of exposure. Please avoid it if you're seriously planning to practice. My suggestion, and I mean, that's a suggestion you'll get almost everywhere. And take up psychology only if you are someone who's very curious about people and emotions and behavior. You love people, you love life, you love being with people. You want to understand human behavior. You want to understand why people are doing the way they are doing. Okay, if you have that curiosity, psychology is a subject for you. If you are patient enough and you are okay with, long-term learning and growth, be prepared that if I come in this field, it's a lifelong learning, because new research will keep happening and you will have to be up to date. What I know today will change after 10 years, because after 10 years, new research will come. So you have to be up to date with the latest research. It's a lifelong learning and growth. And if you want a career which is meaningful and satisfying, where you know that you're going to change somebody's life. So if you're okay with that, okay, profit thoda kam hoga to chalega, paisa thoda kam hoga to chalega, but I want to do something meaningful in my life. If this is who you are, then psychology is a perfect fit for you. I hope this entire session has been fruitful. I hope I have clarified a lot of confusion that you had in your head. This was only the first session. There are going to be many online classes where we are going to take up one difficult therapy after another, one difficult theory, one difficult concept, and explain in complete simple words. Okay? Thank you very much, all of you, for this lovely comments, for being with me throughout the session and interacting. It really mattered, because it's lovely to know that somebody is there on the other side and listening attentively. So thank you very much. Have a very happy day, and kindly follow me. I'm available on Instagram, YouTube, LinkedIn, Facebook. On LinkedIn, I keep writing a lot of posts, okay? And I keep uploading a lot of reels and videos on mental health, related on mental health. Also, please follow me on YouTube and please click on, notification button, notify me, so that next time when I come live, you will get that notification, so, you don't miss on any of our live sessions. And live sessions, gives us a chance to interact, right? So please subscribe and click on the notification button. Okay. We will try to have one live session every week. Okay. As far as possible, we will try to have one session every week. If you go on my YouTube or Instagram accounts, you just have to type Dr. Zarin Sethna. I'm available everywhere. If you go on any of these accounts, you will see almost 500 reels by now on various aspects of mental health. So you can actually scroll back and check out, I've spoken on so many different areas of how do you deal with breakup in romantic relationship, how do you cope with stress, how do you deal with narcissistic partners. I mean, I'm sure you'll find some of it interesting, because you're interested in human behavior. So thank you very much, everybody, and we stop our session for today. Have a happy day, all of you, and God bless you, everybody.